With this week's social story, that's where we post 3 stories on our social media and you decide what we take a closer look at. This week's choices: a new study finding no link between using Tylenol during pregnancy and autism, NASA's lunar return, and student loan payment changes. And with 39% of the vote, you chose that new study published in the Lancet Obstetrics, Gynecology, and Women's Health. Researchers found no indication that children born to mothers who use acetaminophen, the active ingredient in Tylenol during pregnancy, have an increased likelihood of autism. Doctors consider acetaminophen to be the only safe over-the-counter option for pregnant mothers to treat pain or fever. Our medical contributor, Dr. Alok Patel, joins us now to break this all down. Thank you. Obviously, it's always a pleasure to talk to you. What data was looked at here?
Well, I'm not surprised that this was the social story that was chosen, because this has gotten a lot of buzz over the past several months. In this specific study, researchers in Europe basically dwindled down from thousands of published papers and looked at 43 specifically high-quality studies, and what they tried to put more weight on were sibling-controlled studies. So this is a situation in which a pregnant mom took Tylenol in one pregnancy and not the other. And after looking at all the data and controlling for factors such as genetics and home environment, they arrived at the conclusion that there was no evidence to suggest that taking paracetamol, aka acetaminophen, aka Tylenol, increased the risk of autism, ADHD, or harmful neurodevelopmental outcomes.
So, Dr. Patel, what more does the study say about the science behind this?
What the study essentially was showing is that there is no association, which is an important thing for people to understand, because we know that acetaminophen is the only safe option in many cases for pregnant women who may be having uncontrolled pain or a fever. And those two situations can confer some risk to an unborn baby. And so that's an important distinction that these researchers wanted to make. And again, everyone who has talked about this study or has made any opinion about acetaminophen in pregnancy and a potential risk for autism has acknowledged that, guess what? Acetaminophen in any case should not be taken without any type of guidance or taken like a vitamin. It is important that people go to a healthcare professional or taking these as indicated.
Now, how does this differ from the position taken by the Trump administration that claims acetaminophen causes autism?
It's nearly the opposite. And so last September, last fall, people heard these warnings from HHS about a potential leak, and they were citing some papers which did not have the same type of control methods. And in fact, the researchers looked at the same type of studies and arrived at a different conclusion, again, because they were placing more weight on these sibling-controlled studies. So this leaves people with a little bit of confusion, but I like to remind everyone that HHS also was putting this in the wake of saying that they wanted to find a cause for autism. So I've already heard from people saying, oh my gosh, we need to find a reason why autism is rising, or I took acetaminophen in pregnancy, I'm so concerned. And this is exactly what happens when we have mixed information. But so far, researchers agree that this is the largest set of evidence to date suggesting that there is no link between Tylenol and pregnancy and autism.
Now, I want to talk about that mixed information you just mentioned. What do women who might not be clear on what the government is saying versus what the science states need to know if they have pain or fever during their pregnancy?
The first thing I want to do is empathize with anyone who is confused about this, and also reiterate that if somebody is pregnant and has concerns, to please talk to your OB-GYN, to your family medicine doctor, to a board-certified healthcare professional who can help you truly understand what the underlying cause of your fever or your pain may be. Because the reality is that an untreated fever in pregnancy can lead to birth defects. It can lead to dehydration. It can lead to miscarriage. And so the first thing you want to do is make sure you're controlling for any type of potential infections, making sure that you're staying healthy, that you're getting those regular doctor checkups, you're getting vaccines to prevent any type of infection from harming your baby. And then again, if you are in a situation where you have a fever, you're in a lot of pain, because guess what? Physiology changes in people's bodies and people experience pain, that you are talking to your doctor and you're getting recommendations for medication as needed. What we worry about is that this fear about acetaminophen would drive some people to taking medications which we know are not safe in pregnancy. We want to stick with what we know is safe based on the evidence.
All right, great information. Thank you so much, Dr. Patel.
Thank you.